Okay, so everybody, welcome to today's Introduction to Systematic Reviews workshop. I'm just going to share the presentation slides. Before I do, just while you can see myself and my colleague Aalya. So I'm Louise Tanner, and I'm a research associate in the evidence synthesis group at the Population Health Sciences Institute. So my work mainly involves undertaking systematic reviews and other types of review. And I will let Aalya introduce herself.
Good morning, everyone. My name is Aalya Al-Assaf. I work as a research associate at the NIHR Innovation Observatory at Newcastle University, and I have participated in many systematic reviews. And today I am going to talk to you about systematic reviews.
Thank you very much, Aalya. So Aalya is going to present the first section, and then I will take over. So Aalya, would you like me to share the slides, or would you like me to share the presentation, and you just want to let me know when you want me to move on to the next slide?
Yes, please. Yeah, that would be great. Thank you.
No problem. Sorry, if you could just bear with me for a second. There we go. Can everybody see the slides?
Yeah, I can see it.
Yeah, I can see that.
Brilliant. Thank you very much. So just before we start, I should maybe mention that we are going to present this this workshop in sections. So what we've decided is that at the end of each section, so each section is quite short. At the end of each section, where we cover a particular topic, we'll then kind of pause briefly, and if anybody has any questions, you'll have the opportunity to ask those questions at that stage. So if you want to, actually, it's possibly best if you don't put questions in the chat, just in case it's a bit distracting for people, but please feel free to kind of note down any questions, and we'll give you plenty of opportunities to kind of come back to things that you would like to kind of us to cover in a bit more detail or to clarify. So Aalya, shall I hand over to you to go through the learning objectives?
Yes, yeah, thank you, Louise.
Okay, is this mode okay, Aalya? Would you prefer the full screen mode?
Yeah, I think it would be great if we could put it on the full screen.
Okay. There we go.
Perfect. Thank you so much. So, hello everyone. Today we are going to talk about systematic reviews, and we are going to talk about what is a systematic review and why undertake a systematic review, who undertakes systematic reviews, and who use evidence from systematic reviews. And then we are going to talk about what are steps involved when undertaking a systematic review. So first, I'm going to give you some introduction about systematic reviews. A systematic review is a type of research methods. Could we move to the next slide, please? So it's a type of research method that attempts to collate all empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question. So it uses explicit and systematic methods that are selected in order to minimize the chance of bias, and thus providing more reliable evidence, more reliable findings from which conclusion can be drawn and decision made. So from this definition, we can see that systematic reviews have characteristic points. So if you can click next, please. Yeah, so these are the points that are highlighted here that characterize systematic reviews. So they try to collate all empirical evidence, and we wish to have a pre-specified eligibility criteria that answer specific questions. So there should be a specific research question, and the method should be explicit and systematic in order to minimize bias. Could you press next, please? Okay, so Why undertaking systematic reviews? Why not traditional reviews? So in traditional reviews, it's unclear how included studies were selected, whereas in systematic reviews, there should be a protocol that specifies exactly what is the review question, what is the research question, and what are the eligibility criteria or the inclusion criteria. Also, in traditional reviews are based on incomplete set of studies, whereas in systematic reviews, there should be a comprehensive, thorough, and systematic search of the literature to find all the relevant studies. Traditional reviews may not consider the quality of included studies, whereas systematic reviews should have standardized critical appraisal across all included studies. And in traditional reviews, it's unclear how the conclusion will follow from the included studies, whereas systematic reviews methods are transparent and reproducible. Next slide, please. Okay, so the benefits of systematic reviews, first, it minimizes the impact of error or bias, and it highlights where there is no sufficient evidence, where there is a gap in knowledge. And also combining the results, the findings from different studies can highlight new findings. And it also it can mitigate the need for further clinical trials. Systematic reviews can facilitate rational decision-making because healthcare providers, researchers, and policymakers can have lots of research. There are many published studies, millions of citations, and there are hundreds and hundreds of clinical trials. So it makes it usually unmanageable, impossible to make an evidence-based decision from individual studies. So combining those studies and systematic reviews facilitate rational decision-making, and also enable practitioners to keep up to date with the evidence accumulating in the field and to practice evidence-based medicine. Okay, so who undertakes systematic reviews? There are like Cochrane collaboration and Campbell collaboration. They undertake systematic reviews. Regulatory bodies like NICE, academics, researchers, and clinicians, they undertake systematic reviews, and also students like PhD students and MSc students, and they undertake systematic reviews. And who's involved in systematic reviews? Usually the teams are multidisciplinary teams that include clinicians, healthcare researchers, information scientists, statisticians, health economists, and also patient and public involvement, especially for guidelines. Okay, so do you have any questions so far about systematic reviews? Shall I proceed? Okay, then
You're okay to proceed, Aalya. I can't see any. No, I don't think anybody has any questions at this stage.
Okay. So I'll move on then to the next step, which is systematic review process. What are the stages? What are the steps required to do a systematic review? Next slide. Yeah, thank you. So the key stages, the first stage, which is the fundamental stage, is defining your review question or your research question, which should be specific and very clear because it will have an impact on all other steps of systematic review. So you need to be very clear in the research question. And once you develop the research question, then you would need to develop the review protocol, which is the roadmap for the review. In the review protocol, you would need to specify how you are going to undertake this review, all the steps, and what are the eligibility criteria, what type of studies you are going to include and what type of studies you're going to exclude. And then you will start the search of the literature, which should be a comprehensive and thorough search of literature to identify all relevant evidence. So trying to search different databases and different sources in order not to miss any relevant study. And after getting the relevant studies, then you would need to assess the retrieved studies according to the pre-specified, predetermined eligibility criteria that you have specified in the protocol. And then you will select the number of studies that matches the inclusion criteria, and then after that you will do the data extraction, which is the you will extract the information, the required information from the included studies, and checking the accuracy of the extracted data, and then assessing the quality of those studies, doing a critical appraisal of the included studies. And then after that, you will do the data synthesis, which is combining the results of the included studies. And this can be done narratively, and this is called a narrative synthesis of data, or statistically by using statistics, and that's what's called meta-analysis. And then reporting the results and translation of knowledge by disseminating the information to relevant audience using the appropriate format. Okay. So developing research question, which is the first step in systematic reviews. Next slide, please. So the research question is the first step, and is a fundamental step. As mentioned earlier, it will have impact on all other steps in the systematic review, and therefore it has to be clear and specific. The research question can be broad or it can be narrow. So as you can see from these examples here of the research questions, so if you look at the first question that says, what are the effects of surgery on functional outcomes in people with throat cancer? This is generally a broad question. If you compare it with the second question, what are the effects of transoral robotic surgery on swallowing in adults with oropharyngeal cancer? Now, this is a narrow question relative to the first one, because the second question specifies the type of surgery, whereas in the first question, it just says what are the effects of surgery. It doesn't specify the type of surgery. That's one thing. Also, the first question tries to find the effect of surgery on functional outcome. It doesn't specify a certain type of functional outcome, whereas in the second question, it's asking about the effect of transoral robotic surgery on swallowing. So there is here a specific outcome that they want to investigate, to study. And also in the second question, it says in adults. So here we can have an idea about the age group of people, of patients, whereas in the first question just says people, doesn't specify the age. And the type of cancer in the first question is throat cancer, whereas in the second one is more specific. It is oropharyngeal type of cancer. So you can see here, it is the second one is a narrower question than the first one. Okay, so can we move to the next slide, please? Okay, in order to formulate your research question, there are certain frameworks you would need to use to formulate a clear research question. The most commonly used tool, which is used in the if you are doing a review on effectiveness questions, is the PICO, or sometimes it's called PICOs with adding S at the end. So PICO stands for P stands for the population or participants, who are the relevant patients. I stands for the intervention or indicator. So for example, if you are studying the effect of a new type of treatment, a new medicine or surgery, or a diagnostic test, for example, so this is the intervention. If you are studying the effect of a certain exposure factor, for example, let's say smoking, for example, then the I for the this element PICO could be replaced with E, so it will be PECO, E for exposure, because in this case you would include observational studies, you will not find interventional studies. And C for the comparator or control group. What are the comparator? What are the alternatives that you are comparing the intervention you are studying or the exposure you are studying with? And O for the outcome. What are the consequences? What are the results, the outcome measures you are studying? So this element helps you to break down the information and try to formulate your research question. It's not necessary that you include all those elements in your research question, but it is important to formulate the research question using these elements to be clear. And also these elements, you will be using them when you will set the eligibility criteria of the study, when you will set the inclusion and exclusion criteria. Okay, next slide, please. There is another tool, which is called SPICE tool, is designed for qualitative reviews questions. So if you are doing a qualitative a review on qualitative studies, you would use this framework. And this, the S stands for setting. What is the setting? Where is the, is it in a certain country? Is it in a certain community? For example, rural communities, or is it in a hospital setting? P stands for perspective. Who is this being studied from whose perspective? Is it like from perspective of healthcare providers? Is it from patient's perspective, from like mothers, then the I is for intervention. What is being studied? What is the intervention that is being studied? And C stands for comparison. What are the alternatives that are being compared with? And E stands for the evaluation. How you will measure if the intervention is successful or not. So for example, in this example we put here, they are trying to study the effect or the perspective or experience of pregnant women about giving birth in hospitals and giving birth at home. So the evaluation here is women's experience, women's perception about giving birth at home and giving birth in the hospitals. Okay, next slide, please. Okay, so far, do you have any questions about framing a research question? Okay, so then we can proceed to this exercise. We have provided this exercise, this scenario, and from this scenario, could you please try to formulate a research question using the PICO or PICO's elements? We will give you 5 minutes, so you can try to formulate research question. Please try to make a broad research question from the available information, and also try to make a narrow research question from the available information. And then we will come back together to discuss this exercise. So we will have 5 minutes, and then we will discuss it afterwards.
So just before we start, does anybody have any questions about that exercise, anything they'd like us to clarify? Please feel free to unmute and ask if you, or pop a question in the chat.
Seems quite clear.
Excellent, thank you very much for that. Okay, in that case, we'll give you the 5 minutes, and we look forward to having some feedback with you. Yeah, I think that's been 5 minutes. So shall we reconvene?
Okay, so who would like to share with us the research questions that they formulated?
I don't mind sharing mine.
Great, yes, please.
Yeah, so I came up with evaluation of the major factors that contribute to caries in the baby teeth of young children.
Yes. So that's kind of a broad question, right?
What was that, sorry?
That's a kind of broad question you formulated because you mentioned what are the factors affecting dental caries in children.
Yeah.
Yeah, that's a good one. Would anybody else like to share with us the research question?
Did anybody have a kind of more specific question focusing on specific factors?
Yeah, I try to put it in the PICO format. So young children less than 6 years old. Then the intervention was a bit difficult because there seems to be so many. So maybe you know, any interventional program in the community to improve dental health, you know, in young children. The control group is standard care or no non-participants. And then the outcome was number of dental caries in baby teeth. And then the setting was in the community, maybe.
Wonderful, thank you very much.
Good, thank you. Louise, can we move on to the next slide? Okay, so we try to break down the, yes, oh, sorry, we have a
question from Celestine.
Yeah, I want to try to say the effective intervention among children with dental challenge.
And did you so your question was quite broad, Celestine, rather than focusing on a specific kind of type of intervention or risk factor?
Okay.
Yeah, so yeah, we've had some examples there of kind of broad questions that you've come up with between you and kind of a more specific question, which is really interesting. So just to give some context, this question relates to a review that I undertook, and we were kind of looking at risk factors which increase and factors which decrease the risk of dental caries. So we were looking at kind of a broad range of factors, but we kind of sectioned up the review to kind of focus on specific factors. So it's possible that you could undertake a systematic review focusing on an individual factor, such as dental health program, as was mentioned by somebody who provided some feedback, or you could kind of look at a range of factors and just kind of keep the intervention quite broad and not focus on a specific factor.
Okay, yeah, so we try to break down the information in this exercise using the PICO or the PICO's elements. So the population here are children less than 6 years, or to be more specific, less than 72 months. And the intervention, as obvious in the exercise, there are many types of interventions. So we listed them here. Some of them could be interventions, some of them could be like exposures. So that's why we said either intervention/E, which is exposure. And the comparison could be no, or for example, if you are interested in only one type of intervention, like oral health education for caregivers, so the comparison could be no oral health education for caregivers, or for example, if you're studying the breastfeeding duration, then you would include different durations of breastfeeding as a comparator, so you compare different durations. So depending on the objective, what outcomes you are interested in, and what intervention particularly you are interested in. And also the outcomes are then, it is clear that early childhood dental caries. And depending on the intervention or the exposure factor, the studies that you will include could be clinical trials, like for example, if you would include oral health education for caregivers as the intervention, then you may find some clinical trials, some interventional studies. probably other factors you may find only observational studies, so you would include only observational studies like cohort or case control studies, cross-sectional studies, etc. So we've tried to come up with two type of research questions: a broad one, which is here, which factors influence the occurrence of early childhood caries? And in this case, we haven't specified particular factor, but we are interested in identifying the factors that have effect on the early childhood caries. And we came up with a more specific research question, which is the second one: what are the effects of oral health education for caregivers? And now this is a particular type of intervention we are studying on early childhood caries. So you can see here there are, it can be different. The research question could be broad or it could be narrow. Do you have any questions so far?
Yes, I have.
Yes, please. Yeah.
Can we combine these two questions?
So when you say combine, sorry, I can't see. Oh, Abdi. Hi, Abdi.
Yeah, hello.
Hello there. So when you say combine the questions, do you mean what do you mean by that? Do you mean kind of look at two of the interventions or risk factors rather than just focusing on one?
Yeah, when we look at the research questions, can we combine two of them in one question? For example, which factors influence the occurrence of early childhood caries? And what are the effects of oral health education for caregivers on early childhood caries?
Yes, absolutely. So just the example I mentioned, so this actually example comes from a systematic review that I undertook, and the overriding question was what factors influence the occurrence of dental caries. So that's not focusing on a specific factor, but then we were interested within the review to kind of look at the effects of kind of specific factors. So one of the research questions that we had, which is kind of like a sub-research question, was what is the effect of oral health education for caregivers? And I think we undertook kind of like an analysis where we kind of we sort of pooled data from across the different studies to come up with an effect estimate of how effective that specific intervention is. So yes, to answer your question, you can have kind of like a broader overall overriding question that your review is aiming to address, but then you can kind of split your review up into different sections where you kind of look at specific factors, and you have kind of research questions that are focusing on specific risk factors or interventions.
Okay, thank you so much.
You're very welcome. Does anybody else have any? Sorry.
Yes, I have any question. Why you choose the effects of oral health education? Why don't you choose the other reason or other reasons such as duration of breastfeeding?
Yeah, I think it was just for the purpose of giving you an example of a kind of a specific question. So we could have chosen duration of breastfeeding as another kind of specific example. Yeah, that was the only reason why we focused on oral health education, just because that was just to give a specific example.
I mean, we can choose any factors.
Yeah, absolutely.
Okay, that's fine.
And the reason why we, just to kind of give you a bit more context, the reason why we came up with this list of factors, kind of oral health education, duration of breastfeeding, this review was, I think it was commissioned by the WHO, and they provided us with a list of kind of factors that they wanted us to investigate.
Okay.
Which I think they had some evidence might influence dental caries. And I think we kind of focused on modifiable factors, so things that, so I guess if it kind of genetic factors, there's maybe kind of less point in kind of assessing the effects of genetics on caries. The WHO wanted us to focus on factors that could be kind of modified so that they can kind of come up with some guidance to try to sort of help people to reduce tooth decay in their children.
Okay, thank you very much.
You're very welcome. Does anybody else have any questions before we move on? No, don't think. I'm just flicking down the list of names to see if I can see any hands up. I can't see any. apart from Celestine, but I think Celestine, your hand is up from a previous question that you asked. So I'll assume you don't have another question.
Yes, you're correct.
Okay, no problem. Okay, so I'll move on to the next slide. Systematic review protocols, and I'll hand back over to Aalya.
Thank you. Okay, so once you formulated your research question, then you need to develop your systematic review protocol. And the protocol is your roadmap that will specify what steps you are going to undertake, what clearly you are going to do in your systematic review. Can we move to next slide, please? Yeah, thank you. So yeah, as mentioned, it is your roadmap, and you need to specify the eligibility criteria, the inclusion and exclusion criteria. You need to be very clear about this, and remember, you will have to follow your protocol throughout the process of systematic review. So you have to stick to the inclusion exclusion criteria, and you have to follow every step you mention in your protocol. Could we move to next slide, please? Okay, so why do we need a protocol? This is for the purpose of consistency and transparency, and also to reduce the risk of bias in the conduct of systematic reviews, and to keep everyone together, because everyone, when the systematic review involved more than one person, everyone would need to refer to the protocol to follow the information in the protocol and in conducting their systematic review, and it maintain the focus. And it also aids planning of the resources and time, and it is also required for publication. If you will publish your review, they will require the protocol. Next slide, please. Okay, so resources available to help. There is the PRISMA-P, which is the reporting guidelines for protocols. PRISMA stands for the preferred reporting items for systematic reviews and meta-analysis protocols. It is a checklist, and it provides the recommended items to address in the systematic reviews protocol. And you can, it is available from this source, from this website. And also you can, if you'd like, you can check examples online from like Cochrane website or Joanna Brigg or Campbell reviews, and also the NIHR HTA reports. Next slide, please. Okay. When you create your protocol, where does the protocol go? You can register your protocol on Prospero. Prospero is an international database of the prospective systematic reviews in health and social care and in public health or other fields that have related health outcomes. And they provide a list of registered systematic reviews, and this will help to avoid the duplication, and also it can help in reducing the chance of reporting bias, because you can compare the protocol and the completed systematic review that was planned in the protocol. So you can access it from this website, and you can register your protocol on Prospero. Next slide, please. Okay, and where does the protocol go? You can publish the protocol in journals in appropriate topic area, and you can make it available publicly through your project website or blog. And generally, published or publicly available protocols, by definition, make your review more robust. Okay, next slide, please. Okay, before we move on to literature searching, do you have any question?
Yeah, I have a question actually. I was going to ask, can the protocol be changed at any point during your systematic review? And do you just need to update it, or is that not allowed? Do you have to have everything planned out beforehand and that's just set in stone? Or...
Do you want to answer that, Aalya, or would you like me to have
Yes,
a go?
please, if you can have a go, please. Yeah.
Yeah, it's a really good question. So, I mean, what I would say is that in general, it is better to kind of really kind of define all of your methods and try to kind of not change, because if you kind of change your methods, then it could kind of potentially introduce biases into your review. However, it's often the case that the methods have to be tweaked a bit for various reasons. I think a common reason is that you will kind of specify that you'll kind of do kind of searches of various different databases, but then when you actually come to do the search, you find you've got an overwhelming amount of literature. You don't have enough time to actually sort of process all of those studies. So you've got to kind of refine your search strategy a bit, or maybe only kind of look at published studies. So there are some sort of tweaks that that often have to be made, or it might just be something that you thought might a particular method you were going to use, but for some like meta-analysis, but then when you come to look at the data from the included studies aren't suitable for including in a meta-analysis. Therefore, you need to take another approach. So you can amend your protocol, and on Prospero you can actually log into Prospero and you can make amendments, but when you do make amendments, they will be kind of flagged to people who are kind of looking at your protocol on the website, and it's really important that you kind of justify the reason why you have made changes, because as I say, it could introduce biases. So I think the key I think to answer your question, yes, you can make changes to your protocol, but you can kind of it would be termed deviation to protocol, but as long as you can justify the reason why you've made those changes, and maybe acknowledge in your kind of review write-up how kind of any changes that you've made could potentially have kind of affected the results, sort of introduced bias into your results.
Okay, thank you very much.
You're very welcome. Are there any more questions before we move on to the next section? Okay, so I'm going to talk a little bit about literature searching. So once you've got to the stage where you've written your protocol, you've kind of published your protocol or registered it on Prospero, so you know kind of what methods you're going to be using. Oh no, actually, you would need to think about kind of your literature searches actually when writing the protocol, excuse me. So this would sort of be a stage that would need to be considered when developing your protocol. So literature searching is the method that you use to actually find studies to include in your systematic review. So there are lots of different places that you can search for studies that to address your review, primary studies to address your review question. Probably the first place that people go to when undertaking a systematic review are the bibliographic databases. So bibliographic databases are organized digital collections of references to published literature. And there are lots of different bibliographic databases that are available via the Newcastle University Library website. Within the health, so that the databases that you will search will depend on what your review question is and which kind of what the topic is. In general, the kind of first place we tend to go to within the health sciences would be the health databases, including Medline. That's generally the first database we'll go to, also Embase, Signal. And they list journal articles, the scope of those bibliographic databases will be kind of the biomedical and sort of health sciences. But there are lots of other places that you can search, and it is possible that your review might have kind of other topics might be kind of relevant, might not be specifically kind of biomedical focus. So for example, if you were undertaking a review to assess the effectiveness of a particular type of intervention on mental health outcomes, you might consider searching PsycInfo, because that lists references to psychology studies. It might be that your outcomes are kind of wider social outcomes, such as SATs results, kind of school attainment. which for those kind of studies, you might want to search kind of ERIC, which lists educational references, and ASEA, which is a social sciences database. It could be that you want to search a multidisciplinary database, such as Web of Science. And if you, for example, if your systematic review is aiming to assess the effectiveness of a drug treatment, you might want to look at some clinical trial registries to identify some randomized control trials that are kind of ongoing or completed, assessing the effectiveness of that particular drug on sort of your health outcome of interest. And clinicaltrials.gov is a good place to go to find ongoing and completed clinical trial records. So these are the bibliographic databases, which is where you would probably go to first to find relevant studies for inclusion in your review. But you should also consider some grey literature sources. So grey literature sources would be places that list journal article, well, not journal articles, kind of studies that haven't necessarily been published in peer-reviewed journals, and that you might think, well, why include grey literature in your systematic review, because it's probably not very good quality given that it hasn't been peer-reviewed and kind of published in a peer-reviewed journal. However, that's not necessarily the case, and an example that I would give would be in relation to PhD theses. So often when students finish their PhD, and like me, for example, I finished my PhD, my funding had run out, I then needed to get a job. And some people actually get a job after the PhD in a non-academic role. So they just might have a lack of time, lack of funding to get their research published. So they might just not bother to publish the results from their PhD work, even though it might be decent quality. So you could, for example, look at, I think individual universities and also have repositories for theses completed by their students. And also I think that there are general repositories where you can search for PhD theses and master's degree theses that not specific to a particular university. And it is a really good idea to include grey literature in your review to show that you've searched some grey literature sources, because there is something called publication bias, which is where journal articles are more likely to get published if they have kind of interesting or significant results. So if you're only going to include those studies in your review, then you might be kind of that might lead to an overestimate of the effectiveness of a particular intervention. It might make sort of the flu vaccine look actually more effective than it actually is, because studies that found a positive significant effect of that intervention are more likely to get published. So once you have decided which combination of sources you are going to search to find studies to include in your review, you then need to develop some search terms. And in order to develop your search terms, it's a good idea to use your, to kind of break down your review question. So if you've developed that using the PICO method, you could maybe produce a table like this. And as you can see in the first column, I have it says population, the middle column it says intervention, and in the third column it says outcomes. And what I've done is I've taken terms relating to those elements of the PICOs from my research question, from my review question, and I have so the population, for example, of interest are in this kind of hypothetical review are adults with oropharyngeal cancer. So in the population column, I've written oropharyngeal neoplasms, and then you need to kind of think about all of the different synonyms for that term, all of the different ways in which oropharyngeal cancer could potentially be described in studies. Because when you implement your searches in the bibliographic databases, it will search for the words that you've searched in the kind of titles and abstracts of studies within that database. So you need to kind of come up with a list of synonyms, the different ways in which that term could be specified. So you would do that kind of separately for the kind of the population, the intervention, and the outcomes. If you've got a question that is where you've got a specific comparator in mind, you could add a column for the comparator. If you've not got a specific comparator in mind, then you can kind of leave that out. If you want to focus on a specific study type, then you could add another column, and you could maybe if you wanted to search for randomized control trials, then you would maybe search randomized control trials, RCTs. And in fact, I think there are actually filters that you can use to only retrieve studies with a particular research design. So once you've produced this table with all of the synonyms of your population, intervention and outcome terms, you would need to then combine those terms in order to kind of produce a sort of a search string to put into the bibliographic database, such as Medline. So the main operators, the main terms that you would use would be or, and, or not. So you would use the term or to combine terms within the same category of your PCOs. So if I just go back to this slide, you would say oropharyngeal neoplasms or pharyngeal neoplasms or tonsillar neoplasms or tonsil cancer, etc. And what that would do is to retrieve, it would retrieve any or all of the search terms. So any journal articles which have any of these terms specified relating to the population would be retrieved. So the next Boolean operator is and that is for combining terms between the different PCOS categories. So if I just go back to this slide again, if you're wanting to combine population terms with intervention terms and outcome terms, you could say kind of pharyngeal neoplasms and robotic surgical procedures and dysphagia, and that will retrieve records with only both of the search terms. So it will only retrieve journal articles that have got the TORS, which is your procedure of interest, and dysphagia in the title or abstract. And you can use the term not to exclude certain studies from your search results. So if you're only interested in adults, you're not interested in literature where the study has been done on children, then you could say adults, not children, and that will retrieve items containing that will retrieve journal articles where the study has been completed on adults, and it will exclude any literature where the study has been completed on children. So an example of search string based on this table would be tonsil cancer or tonsil carcinoma and TORS and dysphagia and adults, not children. So that's just an example of what your search string might look like. But this would be a lot more, this example would actually be a lot more lengthy, because obviously we've only got 2 population terms in here, whereas in this table we have kind of a whole list of population terms. So you'd want all of those terms to be included. So you'd have tonsil cancer or tonsil carcinoma, and then the other population terms, and TORS or TLM or transoral robotic surgery, and then you combine that with and swallowing or deglutation or dysphagia. Sorry, I hope I explained that okay. Does anybody have any questions at this stage? I think that was a little bit confusing because I was flicking between slides. Does anybody have any questions about that? Okay, so you just to give you some advice on kind of things that you can do to help you to develop your search terms. So use only the items needed to define the search. So usually you would include the kind of population and intervention terms. Sometimes you'd include the outcomes, but that depends on whether you have a specific outcome in mind, in which case you should include the outcome so that you don't retrieve too many studies with kind of outcomes that aren't relevant to your review. Whereas if you don't have a specific outcome in mind, if there are kind of lots of different health and social outcomes, for example, that are of interest, then maybe don't include the specific outcome terms in your search strategy, because that might kind of limit your search results. It's a good idea to consult an information specialist or librarian for advice on your search strategy. because the search is the first potential major source of bias in your review. If you don't search if you kind of don't search the right combination of databases, if you leave out a database that might contain relevant literature, then you're not including all of the studies that are relevant to addressing your review question. At the Walton Library, I understand there is a service where you can book an appointment with a librarian, and they will discuss with you your search strategy in relation to your review question, and they will provide you with advice and help you to develop your search strategy. Another tip is to use thesaurus headings. MESH headings refer to medical subject headings, and they refer to the way in which journal articles are indexed in the bibliographic databases. So Medline uses the MESH system, and what that means is that when a journal article gets submitted, gets published, and it gets put on Medline, there's somebody who will index that journal article according to the content of the journal, and it's generally based on the keywords. So when you submit a journal article, you're generally asked to provide keywords which describe your study, and those are generally used to categorize, to index the study on the journal article on Medline. So MESH headings are a useful way to kind of search for relevant studies, but it's a good idea to use a combination of keywords and MESH headings, just in case the person who has kind of indexed a particular journal article on Medline has done it sort of incorrectly and has kind of missed off a MESH heading that's sort of that's relevant. And so say if you're searching for I'm just trying to think of an example, so if you're looking for if you're interested in sort of oropharyngeal neoplasms, just say for example, and the person who's put this on Medline has indexed it slightly differently under a different kind of throat cancer, and it hasn't, maybe that journal article won't be picked up by your searches. It's a good idea to use the kind of MESH headings and also keywords when you are searching the databases. Just some additional tips. Truncation allows stemming. So if your outcome of interest is kind of swallowing, then you could use an asterisk to search for the word stem. So this example, swallow with an asterisk in place of the W will search for swallow, swallows, swallowing. You can use the wildcard, which is a $, to replace a letter which kind of varies between languages. For example, randomized controlled trials, randomized is spelt with an S in English language, and it's spelt with a Z in American English. So if you place a $, where the S or Z should be, that will search for randomized with an S studies describing randomized controlled trials where randomized is spelt with an S and where randomized is spelt with a Z. You can use quotation marks to search for exact phrases. So, for example, robotic surgical procedures. So if you didn't use quotation marks here and you just typed in robotic surgical procedures, then Medline would search individually for studies that mention robotic or surgical or procedures. So if you put quotation marks around that term, then you're asking Medline to specifically find studies which mention robotic surgical procedures. You can also use proximity searching, which is where you can search for studies where, for example, the intervention is mentioned within 3 words of the outcome. So, for example, TORS, which is the kind of a surgical procedure, if you say ADJ3 dysphagia, then that means it wants you to search for journal articles where that mentions TORS within 3 words of your outcome of interest, which is dysphagia. It's worth mentioning that the Medline uses MESH headings, but not all databases use the MESH system. There are kind of alternatives. So if you are searching, normally what would happen is that you would develop your search in Medline and then adapt it for other databases, and you should be aware of the kind of different indexing systems that are used in the different bibliographic databases. So just to kind of give you a little bit more, a bit of an example of the use of medical subject headings. So this screenshot shows sort of the Medline search function. And as you can see, I've entered oropharyngeal cancer into the search box and keyword is selected. So if you can see here where it says map to subject heading, if you unselect that and click search, then the database will search for journal articles that mention oropharyngeal cancer as kind of a keyword. But if you select map to subject heading, then that will identify articles where the journal articles that have been indexed using the oropharyngeal cancer subject heading. And it might be the case that there isn't a specific mesh heading for oropharyngeal cancer, but Medline will give you a list of options, other options that you can use instead. So if I just move on to the next screen, if I search for oropharyngeal neoplasms, I can see here that that is a mesh heading. If I want to, say, for example, I'm not an expert on this topic and I'm not quite sure what the kind of the definition of oropharyngeal neoplasms and exactly kind of what that refers to. If you click on this blue circle with the information sign, that will give you a definition of what Medline will search for if you search for oropharyngeal neoplasms as a mesh term. It might be that you look at this hierarchy and think, well, actually, I'm only interested in a cancer that affects the tonsils, in which case you could deselect the oropharyngeal neoplasms mesh heading and select the tonsillar neoplasms heading. Alternatively, it might be the case that you're not specifically interested in oropharyngeal neoplasms, but you're interested in kind of throat cancer in general, in which case you could deselect the oropharyngeal neoplasms mesh heading and instead select pharyngeal neoplasms, and that will kind of give you broader search results in terms of the outcomes. Okay, so are there any questions on literature searches?
Can I ask, is there any particular database which kind of like semi-automates this for you? Because it would be quite nice at the end to put it in the supplementary material, you know, you've done this search and then all your search terms are there, etc.
Oh, so do you mean that if you develop your search strategy in Medline, can you then transfer it to other databases?
Oh, yes, and then also if it prints out what your, what you've actually searched for, so you don't have to manually do it, because it seems quite kind of labor intensive.
Yeah, okay, so in terms of your first question, I'm pretty sure that there is, I think actually there is a system where you can actually just transfer your search strategy from Medline to other databases. And I think I might be wrong here, because I have to be honest, I'm not an information specialist. I have done some literature searching, but I'm very well supported by my kind of the information specialist team who is part of the evidence synthesis group. I think actually the Ovid database allows you to transfer your search strategy between Medline and Embase and maybe another database. But now that you've asked that question, I'm actually going to investigate that, and I will send an answer to the people who are participating in this seminar. I'm going to start a list of questions that I would like a bit more information in order to answer. But as I say, I'm pretty sure that that tool is available, so you can transfer your search strategy between certain databases that are supported by the same kind of overall network, like Ovid, for example. But it might be the case that you have to kind of redo your search strategy where there's another database that isn't run through Ovid. In terms of your other question about kind of being able to print out your search strategy, yes, I think what you would need to do is actually log into so when you log into Medline, I think you might need to create an account, and then you can save your search strategy, and you can then which is really helpful, because it means that you can then sort of copy and paste it into your final review, as you mentioned. And also if you undertake a systematic review, but then say it's a really topical subject and there's lots of literature being published on that subject, like coronavirus, for example, lots of literature being published. So by the time you actually come to write up your review, it's likely there'll be a lot more articles that have been published that are relevant to your review. And sometimes journals, in order to publish your review, they will say, well, your search strategy, your searches have to be up to date within a month of, you have to have rerun your searches within a month of submitting it for publication. In which case, it's really helpful to have your search strategy already stored in the databases, because then you can just go back to the database and rerun the search, and it will just give you the search results will include all of the studies that have been published since your previous searches. So I hope that answers your question. Yes, you can save your search strategy on kind of Medline and certain other databases, possibly not all of them. It depends which sources that you're actually going to search, but certainly the ones like the main bibliographic databases like Medline. And as I think kind of Ovid, if you search through Medline through this thing called Ovid, I think that enables you to convert your search strategy or transfer it over to kind of other databases, certain other databases.
Great, thank you.
You're very welcome.
Louise, I think there are some facilities in some databases that allows to do the frequent search, like automatically frequent search, like every week or every month, depends on how you set that frequency, and it sends the results by email.
Mm-hmm. That definitely rings a bell, Aalya. Yeah, I think you can ask for. Yeah, I think you can request that the database, as you say, kind of sends you any update, any new journal articles that have been published since you've implemented your searches, and it will actually email those results to you, any that match your search strategy. And I assume that will be an option if you sign up for an account with the database. Are there any more questions before we move on to the next section? Any more questions on well, searches or literature searches or anything else that we've covered so far?
Hi, can I just ask, is it advisable then, because the mesh term is linked to the terms that are kind of, associated or they are entered manually, if I understood correctly?
Yes, the mesh terms. So you would enter a term manually, like it might be oropharyngeal cancer or it might be throat cancer. And if you select the option where it says map to subject heading and then you click search, oropharyngeal cancer, as you can see, that is actually a medical subject heading, but it might be that if you type throat cancer and then click search, that it doesn't look like throat cancer is, there is a mesh heading for that. So it would probably give you this list, and then you would need to identify which of these mesh headings are relevant to you. And you could do that through looking at these information, clicking on these information symbols, and that will give you kind of a definition of what each of these mesh terms refers to. And then, so if throat cancer was your outcome of interest, you would need to then decide which of these mesh terms are kind of relevant.
So it's always advisable to go for mesh terms, or it's better like not to select that map? How is it called? Yeah.
Yeah, I would say the belt and braces approach, the best approach would be to use a combination of mesh headings, mesh searches, which is where you're picking up articles that are indexed in a certain way, and also use keyword searches. I think the best approach, the most robust approach, is to use a combination, in which case, this example, you would search oropharyngeal cancer and select map to subject heading. And then you can search this as a mesh heading, and that will give you results. But you can also, I would also search oropharyngeal cancer and deselect where it says map to subject heading, and that will give you all of the results where oropharyngeal cancer has been actually mentioned in a title or abstract. So then in the searches, in your kind of list of searches, you would have oropharyngeal cancer as a mesh heading and oropharyngeal cancer as a keyword, and you could combine those two with the Boolean operator or. So then that would give you the results of journal articles where oropharyngeal cancer is either a kind of a mesh heading by which that journal article is indexed, or where the journal article has just mentioned that term. So it might be that there's a journal article that is relevant to oropharyngeal cancer, but it just hasn't been indexed correctly, and it hasn't been indexed using that specific term. So if you use the keyword search in addition to the mesh search, then that means that you're going to kind of like pick up that article, any articles that have kind of fallen through the cracks and that haven't been indexed correctly using the mesh headings.
Okay, so when you say index correctly, does this mean that a librarian does this indexing, or is it done manually, or?
It's a good question. I'm assuming that I think it's done. Actually, I don't know. I think it's done by a librarian, but then again, there are so many journal articles published. It's a very big job. So maybe it is done. Maybe it is done automatically using. When you submit a journal article and you've got to give 5 words that would describe your journal article, maybe it's done automatically using those 5 words, and it could be that you as the author, if there's a particular, because I think you're limited to five words, so maybe there's a word that you've got to leave off. Like for example, if I'm submitting a systematic review and I feel that I need to kind of use up the 5 words based on the content of the review, based on the kind of PICO elements, but there isn't space to add kind of systematic review as a keyword, then that means that that is, although systematic review will be a relevant mesh heading, it's not being indexed as a systematic review. I think it's based on the keywords, and it could be that certain keywords that are relevant aren't specified, and therefore the mesh system isn't being comprehensive, and it's not comprehensively indexing articles according to all of the relevant aspects, if that makes sense.
Yeah. That's perfect. Thank you.
You're very welcome. Does anybody else have any questions?
Louise, we have a question in the chat from Anna Harvey.
Yeah.
Anna asks, do you need to come up with all your search terms before you start, or is it iterative?
It's a good question. So do you mean before you actually implement the searches? Do you mean, can you, I think what I would suggest actually is to do some scoping work. I think I would suggest just to initially look at your PCORS elements and just start listing synonyms for those words. And maybe just do a little bit of scoping work. So kind of go on to Medline and just look at, just type in some of those kind of search terms and see what comes up, and just see if there are any other terms that you could add. I mean, I think once you, I think it's iterative before you actually implement your search. You can kind of like build up your search by kind of doing a bit of scoping work and sort of adding terms. But I think once you've actually implemented your search, I think to then kind of go back and add a heading, I think it might get a little bit messy. So I think it's a good idea to be quite confident in the search strategy before you actually kind of implement it, so that you're not having to go back and adapt it and then sort of trying to identify which results are, I think it could get a little bit messy. So I think I'd try to develop a search strategy that you're confident with before you actually sort of implement it. Okay. As I say, I think what I would definitely advise is that if you are developing a search strategy to approach the librarians at the Walton Library for advice. They are very knowledgeable and experienced, and they would be able to kind of give you a lot more kind of guidance and tailored to your specific review question. So I think we'll move on to study selection and data extraction. I'm going to pass back over to my colleague Aalya, who will present this section.
Thank you, Louise. Okay, so once you formulated your research question, and then you formulated your protocol, and then you started searching the literature, and in the protocol you specified the eligibility criteria, the inclusion and exclusion criteria, and then after that you started searching the literature. Now you will move on to the next step, which is the study selection. And then afterward, you would do the data extraction. So I'm going to talk first about the study selection. Can we move on to the next slide, please? Okay, so study selection. After you've done your literature search, you will have a number of studies that were retrieved from the literature search. So you will now need to do the first round of sifting, in which you will screen the retrieved articles. You will just need to screen the title and abstract of the retrieved articles against your predetermined eligibility criteria, the inclusion and exclusion criteria. And then obviously there are many of what articles that are not going to match your inclusion criteria, so you will not include them, you're going to exclude them. And the ones that you think are potentially eligible, then you will need now to retrieve the full text of those articles to go to the second step of the selecting studies, which is the second round of sifting. And in this stage, you would need to read the full text of the articles to assess their eligibility against the predetermined inclusion and exclusion criteria. You would need 2 reviewers to screen the full text of these articles, at least 2 reviewers, and another reviewer to check if there's any in agreement between the so if there's any there's lack of like they don't agree to each other if they would include those studies or not. So if there's any disagreement, then the third reviewer will resolve this issue. Okay, there are some sources that you can use there are like programs or softwares that you can use to do the screening. One of them is Ryan, and also there is the Covidence and the EPPI reviewer, and also you can use EndNote to do screening of studies. The sources or the references to these websites and programs are available at the end of this presentation at the references slides. So if we move on to the next slide, please. Okay, so after you've resolved everything and you've decided on which articles you are going to include, what study you are going to include in your systematic reviews, then you will move on to the next step of systematic reviews, which is the data extraction. Data extraction means the collection or the gathering of information that you will require for your systematic review from the included studies. Sorry, can we move on to, yeah, thank you. So you would need to develop a data extraction form, a standardized data extraction form that you are going to use throughout the whole included studies when you will extract information. And we can talk about the options later on. The information you would need to collect range from information that are about the citation of the study to be able, so make you able to identify what study, like the citations, the year of publication, and then the characteristics of the studies, like characteristics of the population, the details of the intervention or exposure, outcome measures and results, etc. And again, there are some available data extraction forms and programs that you can use for data extraction, like Covidence and the EPPI reviewer, or you can develop a data extraction form using Excel sheet or worksheet. But at the beginning, you would, before you start your data extraction form, you need to develop one that you piloted and then you test it, and then you will come up with a final data extraction form that you are going to use throughout the whole number of studies that you include in your review. Can we move on to next slide, please? Okay, an important point that when you extract information, you would need to extract sufficient information to describe the studies and to make you able to undertake the analysis that you will require. And it's also important to be accurate when you extract information, because if you will extract, if you are inaccurate in extracting the information, this will impact the data synthesis and analysis. So, and also, you don't need to extract too much information that will waste your time and effort. The most important thing is that you extract the information that you require, make it and be sure that you extract the information accurately, so you wouldn't need to return to the full text papers when you will do the analysis and the synthesis. And remember, the protocol is your roadmap that you will need to follow throughout the process of your systematic review. Okay, can we move on to next slide, please? Okay, so for data extraction, the process needs to be consistent, and as I mentioned earlier, there should be a standardized data extraction form, and the data extraction is ideally done by two people who would do the data extraction independently. But if this is not possible, then one person would do the data extraction, and the second person would need to check the extracted information, need to check the accuracy of the extracted information. And of course, there should be regular discussions throughout the progress. And if there are some disagreements there, they need to discuss as well. And don't leave it to the last minute, don't leave it to the end. You would need to discuss these throughout the process of data extraction regularly. Can we move on to next slide, please? Okay, so do you have any questions about data extraction and study selection before we have a comfort break?
Oh, will you be talking about bias later, or
Yes.
or separate?
Yes, Louise is going to cover the critical appraisal after the break.
Thanks.
Just before we go off, can I just, I've just thought of something. There was a question that was asked about the search strategy just before Aalya started talking about data extraction, and about what, can you go back and tweak the search strategy? And I said, well, it's better if you don't do that, if you kind of make sure that you're quite happy with it before you kind of run it and just run it once. What I would say that it's what you should do is a robustness check, where you have say half a dozen journal articles that you think are kind of really relevant to your review. You know that they will be included in your review because they kind of meet all of your PCORs, all of your eligibility criteria. So you've got a list of kind of about 6 studies, you know, should definitely be included in your review. And what you can do is look at the when you're developing your search strategy, you can, like say in Medline, you can look at the search results that Medline identifies and check that those 6 studies are in the search results. And that is a robustness check to make sure that your search strategy is identifying the right types of study. So if any of the 6 articles, say 6, that's just an arbitrary number, aren't in your search results, then the next thing is to check that Medline actually indexes those articles. And if Medline does index those articles, if you kind of search for those articles individually on Medline, and if Medline does list those articles but they've not come up in your search results, then that might mean that you need to kind of tweak your search strategy a bit to make sure that you've got all of those relevant articles in your search results. And once you've got a search, you've run a search and you've identified those relevant articles, all of those relevant articles, you can then be kind of confident that your search strategy is kind of working and is picking up the right types of study. So on that note, we'll have a break. If you don't mind, I'm going to kind of make the break slightly shorter. So I make it 23 minutes past 12, 24 minutes past 12. Can we maybe just come back at 12:30 just to make sure that we've got a couple of sections still to cover, to make sure that we get through everything we need to. So we have a sort of 5-6 minute break, and then we'll reconvene at 12:30. Thank you very much.
Thanks.
Okay, I think we'll move on to the next section. Hopefully everyone has had a chance to have a kind of a comfort break and get a drink if they would like one. We're going to move on to the next section now, which is quality appraisal. So at this stage in your review, you have you've implemented your literature searches, you have screened those results, you've got a kind of final list of studies that are getting included in your review. You have extracted the relevant data from those studies. So the next thing we need to do is to check the quality of the studies that are included in your review. So what is quality appraisal? So critical appraisal is the process of systematically examining research evidence to judge its validity, trustworthiness, its value and relevance in a particular context, and it is intended to enhance the healthcare professional's skill to determine whether the research evidence is true, i.e. free from bias, and relevant to their patients. So why do we undertake critical appraisal? Well, there are various reasons. So research can vary in methodological rigor. So the quality of evidence can vary between studies. Flaws in the design or conduct of a study can result in bias, which can obscure the observed effects of an intervention or an exposure. Recording the strengths and weaknesses of included studies provides an indication of whether the study results can be believed. And assessment of study quality gives an indication of the strength of evidence provided by the review, and it can also inform the standards required for further research. So if you want to take a systematic review and you find that the evidence base is quite immature, the studies aren't very robust, then you can recommend that future studies addressing your review question are undertaken with more kind of robust study designs. So what are the main issues affecting the quality of primary studies? So there are a number of issues. So first of all, appropriateness of the study design to address the research objective. So in some cases, a particular research question can be addressed using different types of study design, but some designs are kind of more appropriate and more robust than others. For example, in public health research, cross-sectional studies are very good for assessing the prevalence of a particular health condition, whereas if you want to assess the effect of particular exposure on a particular health outcome, then a cohort study would be a more robust design to use. And randomized controlled trials are considered the gold standard for assessing the effectiveness of interventions. So, for example, the effects of a drug on a particular health outcome. So an RCT would be the best study design to use in that to address that research question. Bias can affect the quality of individual studies, and I'm going to talk about that in the next few slides. So other issues would include generalizability, which refers to the applicability to other populations and settings, and it's also known as external validity. So you might pick up a study which is very good quality, and it's assessing the effects of a particular intervention on a particular health outcome, and that relationship that association is of interest to you. However, the population in the study might be kind of older people, where you might specifically be interested in children, in which case the results from that study would have kind of limited applicability to your review question. You'd also consider the choice of exposure and outcome measures, whether they are valid, so whether they are measuring what they are supposed to, what they say that they are measuring, and subjective versus objective measures. So if you, for example, in measuring anxiety, you might have one study that asks people to rate their level of anxiety on a scale of 1 to 10. So that would be a subjective assessment, and a different study might measure blood concentrations of cortisol hormone, and that would be a more objective assessment, which is generally considered superior. Other issues include statistical issues such as power. So generally, studies that have larger sample sizes have more statistical power, which refers to their kind of ability to identify a significant effect where one exists. And also the effect estimate is more precise, and the error margin around the effect estimate is generally smaller when you have a study that has a larger sample size. And finally, quality of reporting. Does the study follow reporting guidelines? So for each different type of study in public health research, certainly there is a reporting guideline, which kind of is a checklist of items which authors should report when writing up their study. So in the case of a systematic review, we would use the PRISMA guideline to we would follow that and make sure that all of the items listed in that are included in our review when we write that up. So there are a number of different tools which you can use to help you to assess the quality of individual studies that are included in your review. This makes the process of quality appraisal more systematic. So there are tools available for individual specific study design. So for example, if you wanted to assess the quality of randomized controlled trials, then the Cochrane risk of bias tool is probably the best tool to use in order to do that. If you had studies which were kind of with a quantitative design, but there weren't randomized studies, so things like cohort studies, case control studies, cross-sectional studies, these can all be assessed using the Robbins I tool. And the Robbins I tool was developed by the Cochrane collaboration, which is the Cochrane collaboration produces gold standard methods. So the Robbins I tool and the Cochrane risk of bias tool are very good quality and robust tools for implementing quality assessment, although they can be a little bit difficult to use if you've not implemented quality appraisal previously. So the Robbins tool and the AMSTAR tools are tools for assessing the quality of systematic reviews, and the CASP and JBI critical appraisal tools are kind of the CASP program has 9 tools, 1 tool for assessing, they have tools for assessing different types of studies. So a tool for assessing the quality of cohort studies, a different tool for assessing the quality of randomized controlled trials, etc. And actually, if you are new to quality appraisal, then the CASP tools are a good starting point because they're quite user-friendly and a bit more easier to implement than the Cochrane tools, but they are still kind of valid tools. But if you have a bit more experience and you want to use a more robust method, then I would recommend using the Cochrane tools. Okay, so now we're going to talk a little bit about bias. Bias refers to systematic error or deviation from the truth, which could result in the wrong association between an intervention and an outcome, and it undermines our ability to make a causal inference. A related term is internal validity, which refers to the extent to which the observer's effects are true for a population under study, and bias can obscure intervention effects, and differences in the risk of bias between studies can help explain differences in findings, so different effect estimates between studies where the studies are kind of assessing the effects of the same intervention on the same outcome. If you've got variation in the effect estimates, then that could be attributable to bias. So there are different types of bias which we would assess for when assessing the quality of individual primary studies, and the types of bias that I'm going to describe here are ones from that are assessed in the Cochrane risk of bias tool for assessing the quality of randomized controlled trials. Some of these types of bias are also relevant to other study designs. So selection bias refers to systematic differences between baseline characteristics of the groups that are compared. So if you want to assess the effect of a drug on a particular health outcome in a randomized controlled trial, the idea would be that you would randomly assign people to a group where they either received the drug or they received like a placebo, so like a fake drug, and you want to assess the effect of the drug on the outcome. But if the sample size is large enough, and if your method of randomization is successful, then the two groups, the intervention group and the placebo group, should be equivalent in all kind of characteristics apart from whether or not they received the intervention, the drug. And if you have differences in baseline characteristics between the groups, so the groups are different in a way, in ways that could influence the outcome, sort of independently of whether or not they received the drug, then that can affect the results. So performance bias, this refers to systematic differences in care provided between the intervention and control groups that occur because participants or carer act differently because they know which treatment is being delivered. So if the example that I gave, if you want to assess the effects of a drug on a particular health outcome, and you give you give the intervention group the drug and the control group the placebo, but you don't tell them which group they're in, if they guess which group they're in, then that can perhaps influence their behaviour in a way that could influence the outcome. And I won't give a specific example because we're about to do an exercise where I want you to guess the type of bias. So I'm going to give you some examples and you've got to guess which type of bias would be applicable. So detection bias refers to systematic differences between groups in how outcomes are determined. To give you an example here, if say there was a study where you wanted to, there was a study assessing the effects of fluoridated versus non-fluoridated water supply on tooth decay in children, and the dentist who was assessing the level of tooth decay, if he guessed which area the children who he was examining were from, if he guessed whether they had a fluoridated water supply or not, then maybe he would be a little bit more thorough about investigating the teeth of the children who didn't have access to a fluoridated water supply, because he expects them to have more tooth decay. Therefore, he's kind of looking for kind of evidence to support that. So that could influence that means that the children from the non-fluoridated area have a more thorough examination, and that difference in how the level of tooth decay is assessed sort of differs between groups in a way that can influence the outcome. So reporting bias refers to systematic differences between reported and unreported findings. So an example here might be that if say, for example, there was a researcher who was given some money by a toothpaste company to assess the effect of their toothpaste on reducing the level of tooth decay in children. So tooth decay can be, or dental caries can be measured in lots of different ways. It can be measured by the number of decayed, missing and filled teeth, or or individual components, just the number of decayed teeth, just the number of missing teeth, just the number of filled teeth. So say the researcher, because he's being funded by the toothpaste company, he wants to present results that show that the toothpaste reduces tooth decay. He might collect data on lots of different measures of the outcome variables, so the number of decayed teeth, missing teeth, filled teeth, but only report results for the that show that the toothpaste is effective in improving the quality of the children's teeth. So you might miss out results that of measures of tooth decay which show that the toothpaste isn't effective at improving dental hygiene. And finally, attrition bias, which refers to systematic differences between groups in withdrawals from a study. So it might be that if you have a randomized control trial and you randomly allocate people to get the intervention or the control, at baseline, the groups might be well balanced in terms of their characteristics, but it might be that you want to kind of follow people up at, say, 12 months to see whether the intervention has had kind of a long-term impact on a particular health outcome. And it's likely that not everybody from both groups will present at that follow-up assessment, and it could be that whereas at baseline the groups were well balanced in terms of their characteristics or age and health, underlying health conditions, but at the 12-month follow-up you could end up with one group who is maybe older than the other group, just because you've had kind of people dropping out from both groups, and that's led to kind of an imbalance in the age profile between the groups, and that could affect the outcomes. So attrition bias would be relevant in this example. Okay, so we're going to do a quiz. Hopefully, I've set up a quiz on Mentimeter, a sort of piece of software. If I could ask you to bear with me, please, whilst I set that up, because yeah, I'm not the most technological person, so I'm just going to temporarily I'll continue sharing the slides with you whilst I log into Mentimeter, and I'm going to put a link to the place where you can vote into the search, into the chat box. hopefully. Sorry, I'm just going to temporarily stop sharing so that I can see the chat. Okay, so what I would like you to do is, just bear with me. Right, so hopefully if you click on the link that I've just put in the chat, if you click on the link that I've just put in the chat, and I'm going to read out a scenario, and I want you to guess which type of bias is relevant. So if you could all click on that link, could you let me know that if you can see the page where you can select an option?
It started on the scenario 2.
It started on scenario 2. Okay.
I think there should be something you can click at the top of the page saying go to the next slide that changes to. So I'm on scenario 1.
Yeah, it's working now.
It's working. Excellent. So can you all see scenario 1?
Yeah.
Great. Okay, so I'm going to read out a scenario and I would like you to select an option. So the scenario is an RCT, or randomized control trial, is undertaken to assess the effectiveness of vitamin C supplements versus placebo tablets for reducing the incidence of respiratory symptoms over a winter period. Several participants guess which study group they have been assigned to, causing people in the control group to eat more fruit and veg than usual in order to make up for their lack of supplementation. So the answers are, you've got to select which type of bias could be relevant to this example. So selection bias, which refers to systematic differences between baseline characteristics of the groups that are compared. Performance bias, which refers to systematic differences in care provided to the intervention and control groups, apart from the intervention, that occur because participants or carers act differently because they know which treatment is being delivered. Or reporting bias, which refers to systematic differences between reported and unreported findings. Would you like me to read out that scenario and choice of answers again? Or are you happy to just select an answer? Okay, I can see that you have been selecting answers, so that's absolutely fine.
If you shared your screen again.
Yep, sure. Which screen would you like me to share? The PowerPoint slide or the results?
The PowerPoint slide.
Yeah. There we go. Can you see that PowerPoint slide?
Yep, thanks.
No problem. Okay, so it looks like everybody has answered. So I'm going to share the results with you. Okay, so 75% of people have said performance bias and 25% of people have said selection bias. So I would say that performance bias is the relevant answer for this question, because the idea is that the researcher wants to see if vitamin C supplements can improve respiratory health over a winter period. So he randomly assigns people to either get vitamin C tablets or placebo tablets, but people guess which group they're in, and people in the placebo group, because they kind of know that they're not getting vitamin C. They want to they supplement their own diet. So they start consuming more fruit and veg. And that means that both groups are having an increase in vitamin C, which can mean that the vitamin C tablets will seem less effective because the control group are also potentially having fewer respiratory symptoms. Okay, so
can I ask a question?
Yeah, sure.
When we do this in real life, presumably your two reviewers are blinded to each other. You do it independently, and you compare your results. Are there different grades of bias, or is it just yes or no?
Very good question. And I'm pleased that you've mentioned about the kind of the process, because yes, ideally you'd have two reviewers who independently quality appraise the studies, and then you would come together and resolve discrepancies. Sometimes it's not feasible to do that because due to lack of resources. So you've only got kind of one person who does quality appraisal, and maybe a second person checks 10% of those. Yeah, it depends. It varies between tools in terms of how the overall assessment is calculated. So the CASP tools, which are the kind of the easiest tools to use, you don't get an overall assessment, and you don't get any numerical value for each. So you get you kind of work through a series of questions, and each question refers to a specific type of bias or a specific issue. And with CASP, it's just about kind of recording the kind of you would select a response to say yes, there's an issue, no, there's not an issue, or you can't tell, but there's no overall assessment. Whereas with the Cochrane tools, the Cochrane risk of bias tool and the Robbins Eye, I think for each domain you would get a score of high risk of bias, moderate or low risk of bias, and once you've completed the whole tool, you can then calculate an overall assessment, and I think that's calculated. So if any of the individual domains have scored high risk of bias, the overall risk of bias score would be high. If you've got no domains scored high risk of bias, but several of the domains scored moderate risk of bias, then you might consider giving the study an overall high risk of bias assessment. If you scored low risk of bias for all of the domains, then your overall risk of bias score would be low. So I think the answer is it depends on the tool that you use and whether or not it makes an overall assessment of the study quality.
Thanks.
Okay, I think we might just, I'm very aware of the time now, so I think we're just going to move on to the next section rather than doing the next exercise. But I will circulate the slides to you so that you can maybe have a go at that scenario to have a read of that and try and work out from the information presented which type of bias you think is relevant to that scenario. And please feel free to email me if you have any questions about that. So I'm going to share my slides again. Just before I do, does anybody have any questions about what we've covered so far in relation to risk of bias? Critical appraisal. Okay, so we're going to move on. Okay, so I just want to mention that obviously in some systematic reviews, you might be including qualitative studies. In fact, some systematic reviews, depending on what your review question is, your review question might specifically include only qualitative studies. And there is a CASP tool for assessing the quality of qualitative studies. There are probably other tools as well that I'm kind of less familiar with, but certainly the CASP program provides a tool. And some of the issues which are assessed for when assessing the quality of qualitative studies would include credibility, which refers to just the way that the kind of the data that's presented by the reviewer, by the author. Does that reflect the views of the participants studied? So kind of looking at how the correspondence between sort of the raw data from the participants and the sort of explanation of those data by the study author. Transferability, are the findings transferable to other settings? So this would this is similar to the generalizability issue with quantitative studies. So it might be that the study focuses on a specific people with specific characteristics that aren't necessarily relevant to your review question. Dependability, this refers to kind of the transparency of the process. Is the process of research logical, traceable, and clearly documented, particularly regarding the methods chosen and the decisions made by the researcher? So it refers to kind of the robustness of the methods used in the qualitative study. And confirmability, which refers to the fact that in qualitative research, each researcher would bring their own kind of perspective to the study. And so it refers to the degree to which the results can be confirmed or corroborated by others. So if you've got kind of two researchers who use the same methods, would they come to the same conclusions? Okay, so moving on to narrative synthesis. So we're sort of coming towards the end of the presentation now. When you undertake a systematic review, you kind of go through the process of finding relevant studies to include in your review. You've kind of extracted data, you've assessed the quality, and now you want to write up your results section where you want to sort of bring together the results from all of the primary studies, and in order to address your overall review question. So there are different types of synthesis that you can use to write your results section of your review. And all systematic reviews will include a narrative synthesis, which is a textual synthesis of the data. And there are kind of different ways in which you can approach this. You can write this narrative synthesis. There are frameworks available to kind of guide the process. For example, there's a framework by Poppy et al. She provides a framework for writing a narrative synthesis and examples, and I've added a reference to the that framework in the bibliography section of this presentation. So I'm just going to just mention some key points to consider when writing a narrative synthesis. So you would usually kind of tabulate study characteristics, have tables of study characteristics within your results. You've got to decide how you want to present your results. So it might be that you're looking at the effect of an intervention on several different outcomes. So you might want to summarize the evidence of the intervention in relation to each outcome kind of separately, or you might have different risk factors that you're looking at and the effect on one outcome. So you might want to organize your results so that you're summarizing the evidence for each risk factor separately. It's important to be systematic when writing your narrative synthesis. So try to report the same information from the same in the same order for each study. And you could use a best available evidence approach, which is where you summarize the evidence from the more robust studies and the high quality studies first before summarizing the evidence from the kind of poorer quality studies. And you might also want to examine the effect of moderator variables. So for example, if you a systematic review looking at the effects of food and drink advertising on snacking behaviour, you might be interested in whether whether the effect varies between males and females. So you might want to kind of separate the data. So you're kind of looking at the effects specifically in males and specifically in females and seeing if there's kind of a variation. So a subset of reviews will include a meta-analysis, which is a statistical synthesis of the data. And I will show you kind of the output from a meta-analysis in sort of a couple of slides just before the end of this presentation. But first of all, in relation to narrative synthesis, if you find that you don't have appropriate data to undertake a meta-analysis, there are other methods that you can use to graphically summarize the data. So an example would be a harvest plot, which is shown in this slide. An example is shown in this slide where you can so each bar on this plot represents a study, and different characteristics of the bar can represent different characteristics of the study. So for example, the height of the bars can represent the number of the sample size. The numbers, I think they represent the kind of the quality of the study from the quality appraisal assessments. So you can make the you can use different characteristics of the bars, kind of represent different characteristics of the studies, and you can kind of depict the direction of effect of the evidence. So studies that showed a positive effect of the intervention on an outcome, studies which showed no effect, and studies which showed a negative effect of the intervention on an outcome. So it's basically, this is summarizing the direction of effect and also the characteristics of included studies, but it's not providing an overall effect estimate. So there's a lack of kind of precision because you're not providing like a mean overall effect estimate across the different studies. So meta-analysis, which I'm not going to describe in any detail here, but I should mention that we generally provide a follow-up to this introductory session in March, which is a full-day course with a meta-analysis module where my colleague Steve and Steve, my colleagues Steve and Ryan will kind of go into a bit more detail about meta-analysis. But if you want to take a meta-analysis, you're basically sort of pooling the results from the different studies to provide like an overall mean weighted effect estimate, and the forest plot would be the output of that analysis. So if you kind of, for example, in this example, I think this in this review was looking at the comparing the effects of antibiotic treatment compared to appendix removal on the number of adverse events in participants who received each treatment, and we can see here the primary studies that contributed data to the analysis, and in the group of participants who received from each study who received antibiotic treatment, the number of people who had an adverse event and the overall sample size, and that's shown for the antibiotic treatment and also for the control, which is appendix removal. And then this diagram shows the results. So the point in the middle is the relative risk estimate, and the line represents the 95% confidence interval, which is the like a measure of uncertainty around the effect estimate. And you can see that sort of where all of the effect estimates are on this side of the what's called the line of no effect, which shows that in this case the antibiotic treatment was superior as to the appendix removal, because there were fewer adverse events in that group. As I say, it's very, I've not covered meta-analysis in any detail, but if you'd like to learn more about it, then please do look out for the course in March, which will include more information about meta-analysis and how to implement that. Okay, so just very quickly, I think this is the last slide that I'm going to mention, because I can see that we've gone slightly over time now. So I mentioned earlier that when you write your systematic review, you should use the PRISMA checklist, which is just a list of items that you should include when writing up your review. So the PRISMA checklist, I believe, is referenced in the bibliography section for this presentation, and basically you just need to kind of go through each item, and you'd need to kind of list the page number where that particular item is reported. And I've just got a few slides about kind of being organised throughout the systematic review process, just making sure that you've got kind of folders to kind of a good structure, to kind of a good filing structure to make sure that you've got all of your included studies in one place, and your data extraction forms in one place, quality appraisal forms in one place, that you can sort of refer back to and use to write up your report. And yeah, version control is very important. This is a convention that we use within the evidence synthesis group to when we're writing up the final report, just to kind of show the draft number. And version 1.0 is the final version, and kind of any subsequent amendments would be either version 1.1 if it's a minor amendment, or version 2 if it's a major revision. And it's useful to have a Gantt chart, where basically you just write all of the different steps of the review process, and you allocate timings to each of those steps. And the Gantt chart is usually a work in progress. It kind of timings have to change throughout the review, because sometimes things take a bit longer than you'd expected. So that's the end of the presentation. I will circulate these slides, make sure that these slides are sent to you to sort of peruse after this session at your leisure. I'm just going to stop sharing the screen. Just before we go, does anybody have any questions?
I just want to say thank you very much. It's been a very excellent talk.
Thank you very much, and thank you everybody for attending today's session, and also for your participation and for your questions. It's been really interesting, and yes, it's as I say, I'll make sure that the slides are circulated afterwards. The recording should be made available at some point via the FMS YouTube channel. And yeah, so does anybody else have any more thoughts or comments? Okay, in that case, I'd just like to thank my colleague Aalya very much for for co-presenting this session. And yeah, I wish you all a good day, a good weekend when it comes. I'm a bit lost with the days still after the break. I'm still not sure what day of the week it is, but when it comes, I hope you have a wonderful weekend. And thank you very much, everybody.
Thank you very much, everybody.
Thanks a lot. See you next
Thank
time.
you. Bye.
Bye.